All right, so I'm Sarah DeSilvi, Director of Terminology here at Gravity, and I'm really excited to kick off what we call the enhancement cycle of the Gravity terminology work stream. Gravity, we'll go into this in a couple of slides, but we are meeting weekly now to address not just new domains, but also enhancing prior domains, and coding for food is part of that work. Next slide. Thanks for joining. We usually mute folks upon entry, but there's lots of time for conversation throughout the course of the meeting. The calls are always recorded and they're available on the Confluence after the call. Everyone's encouraged to actively participate in the discussion. If you put it in the chat to everybody, we do try to integrate concepts and questions as we're going, right? We have, at the end of every section, we have pauses for questions, but please feel free to pepper them in as we go, because we try to aim for more of a seminar format than anything truly formal. Next slide. It's good to see friends. Hello. As a data standard, open data standard development entity, we are required to follow federal antitrust practices, which basically state that everyone participating on the call has the responsibility to fully comply with federal and state antitrust laws. Again, this grounds our work every single time we do any public work. Next slide. We're going to go through a brief welcome and announcements. Again, just because this is the kickoff of this cycle, there are people on the call who might not know about Gravity, so we're going to do a brief overview. We're then going to do, I think it's by now, it's the kickoff for coding for food. We did a first kickoff a couple years ago. We did phase 1 of the formal work last summer, fall, and are doing phase 2 in this cycle through May 2025. We then have a few different updates in our program enhancements section. We have an initiative really driven by our members and implementers to dive deep into our program concepts in a couple different lenses, and we're going to be going through that as well. Next slide. All right, next slide. Terminology, I detailed this in the opening, but our meetings are weekly now, and they alternate topics. They always happen from 4 to 5:30 Eastern Standard Time. In our new domains call, we focus on development of new domain data standards and value sets, like addressing critical gaps in domains and building value sets to align. In our enhancements call, we focus on enhancing terminology for previously identified domains, which includes refining our program concepts, leaning into coding for food concepts and HICPICs when we addressed food insecurity a long time ago. And so this is the cadence. And so last week was the new domains call. This week is enhancements, alternating every other week. The technical work stream has calls Wednesdays 1 to 2 Eastern Standard Time. Again, all of these can be found on the HL7 conference call calendar. The implementation work stream is moved to quarterly. Our next meeting is on February 27th. And then just note that we'll be at HIMSS, and we have a couple sessions at HIMSS that are Gravity aligned, but there's lots of members also who are presenting at HIMSS in all kinds of different ways. But those are our announcements for today. Next slide. Any questions on general announcements? All right, next slide. Let me just make sure I see. Oh, I see so many friends. Okay. Oh, there's Meg. Hi, Meg. We are about to enter a strategic session, and we noted some opportunities to revise this vision, strategic vision at our last meeting. But I just note that the existing vision with possible edits is the Gravity Project striving to create a world where health and social care organizations readily share the information needed to effectively meet the social needs of individuals, advance health equity, and improve health outcomes of communities by using standardized, possibly, terminology and technology. Again, we had a lot of great comments at the last meeting and are going to be reviewing our vision with members at a new strategic session very shortly. Next slide. So as lexicon for everything that we do, what is health equity? Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. It's really critical to, the quintuple aim, as we call it now. It's the fifth suggested aim in the foundational IHI health improvement strategy that underlines value-based care. Social determinants are the conditions in which people are born, grow, live, work, and age, and they're shaped by the distribution of money, power, and resources. Social determinants of health can offer both positive and negative forces. Really excited to work in the fairly radical act of building protective terminology in our new domain work that alternates with this meeting. Protective factor terms are core to American Academy of Pediatrics, nurses, social workers, strengths-based assessments. Anyway, that's happening in the other meeting. Negative forces are social risks and social needs. And again, this is the lexicon we use when we do all the work we do at Gravity. Next slide. Our members, we could not do it without our amazing members. Both members offer both financial support and knowledge support. And specifically, we're the only HL7 accelerator that has a designated membership model. Working from a social justice framework, we ensure that direct care community-based organizations have a role in shaping the strategy and decision-making within our project. And we also center patients in that work as well. Next slide. How the work streams of Gravity. You are in the terminology work stream. You are in one of our terminology work stream public meetings. The goal of the terminology work stream is one of 3 work streams we have at Gravity. Our primary requirement is building terminology and value sets to support addressing social needs and in alternate uses and use cases, but that's our kind of our North Star. Those encoded value sets are shared by another work stream, which is our technical work stream. We work as sisters in this work, right? All the terminology that we leverage in our value sets are then shared by the technical work stream as they build models for how to exchange data to represent the wisdom and practice of social care. And then we also have our implementation work stream where we test, pilot, and adopt. Next slide. And those are the work streams I mentioned in the announcements. Gravity Project has had a fairly busy roadmap over the course of our now 6 years, 6, 7 of existence. So it kicked off in 2000, well, really conceptually kicked off in 2017 when we gathered in DC to understand how to develop the research requirements and the intervention requirements and the naming requirements for social needs in the absence of data standards. Gravity was a need to craft an open consensus process to identify gaps in terminology and develop data standards was the outgrowth of that meeting. And Gravity was conceptualized and kicked off in 2019. As I just identified in my original formation, I was just a subject matter expert in food insecurity, a former farmer, and food insecurity implementation scientist as a clinician. And then now here we are. We've addressed a host of domains over the course of our time. And this is, again, that new domain work. But the enhancements work fits in and plugs in as ways to deepen the impact and value of the terminology that we create in the terminology work stream. And we've published a few versions of our implementation guide, really constantly evolving to better meet the needs of social care practice, right? Extending our models, expanding our use cases, just trying to make sure that we're giving entities the tools that they need to care well. Next slide. This is our 2025 roadmap. So you can see we are kicking off our February work. In our new domain work, we have the very pressing and timely task of identifying terminology to name protective factors, experience of racial and ethnic discrimination, otherwise known as racism, and toxic stress, with the foundational approaches of adverse child experiences and concepts of weathering. In this meeting, in the enhancement cycle, we're addressing phase 2 of coding for food and program enhancements in order, again, to deepen our solutions for implementers, really driven by the feedback of people in the field. We're always evolving our use cases to try to meet better needs. We're going to, again, have that strategic kickoff very shortly with our members, updating our IG, and again, working in the implementation affinity group, again, notably supporting the implementation, like large-scale implementation, such as the New York 1115 waiver, and other regulatory-driven implementations. Next slide. Hi, Sue. As we do any of this work, and especially in this moment in time, and especially given some of the domains we're addressing in our other work stream, our principles are ever so critical. These are the principles we established in 2019, really to underwrite all the work we do, including from the point of implementation forward. The first principle is improving personal health outcomes. The next principle is improving population health equity. The next principle is ensuring personal control. The next principle is designing appropriate solutions. The next principle is ensuring accountability. And lastly, critically, and ever so importantly, preventing, reducing, and remediating harm. Again, these principles are our guide in all we do, and we test ourselves against them regularly as we're doing both build and implementation, and they're important always. You can find them. Sarah Bahal just put them in the link in the chat for reference if desired. There's a detailing of use cases and application for the principles available on the Confluence. Next slide. Any questions on what gravity is, who we are, who you are as part of that? Because the moment you attend a gravity call, you are gravity too. And then we'll go into the work at hand. All right. Okay, carry on. Next slide. We have a process that we follow. It's fairly formal. I like to say that we have a formal process, but we practice informally within it. Again, we are a consensus community, and I really want to make sure everyone feels like they have a voice in this work. So we're going to go through the process and how we do it and how it applies specifically really to the work of coding for food as we go forward. Next slide. So classically, Gravity builds terminology to support 3 core clinical activities, and we're kind of stretching that as we think about our enhancements work, but it's screening instruments and standardized assessments, concepts to support assessments and the outgrowth of assessment and diagnosis, goals for patient-centered care planning, and all kinds of treatment and interventions. And then we, of course, test and validate that data for uses across patient care, social care, care coordination, population health, public health, value-based payment, clinical research. Really, the data that we create is now live in all of those use cases, given how long we've been around. And then we, as I mentioned, we talked about the domains we've already addressed. And so we go by domain by domain, convening subject matter experts to build terminology to support each of these activities. Next slide. That process is what we are kicking off now. This is the formal process, right? So it's called the Gravity Terminology Curation process. The HCPCS concepts within coding for food are like fully within this. The process that we leverage is evidence-based. It's, we convene subject matter experts and gather the literature. It's consensus-driven. This is where all of you come in. We are an open consensus space, developing data standards together, and all of your voices matter. Semantically consistent. We always ensure that whatever we're doing, and you'll see this really heavily, actually, no, you'll see it in everything that we're doing today. So we always ensure that if we are building something in clinical terminology, that we align it with existing definitions and meanings and purposes existing in social care. So, many of our, and I pause because it's very apparent in our program classification work we'll detail later, where experts in taxonomies and social care implementations such as 211 LA, we just want to make sure that we're not disrupting the way entities are caring for individuals in communities, or how in homelessness we aligned with the homeless management information system. Again, ensuring that the requirements and definitions and meanings that are happening in social care spaces are leveraged within clinical terminologies. But I think about our coding for food experts, right? Many of you come from, food bank networks or, community nutrition projects, right? So that same thing applies in coding for food. And then, of course, it's grounded in the ethics of data justice and social justice, right? We're doing ethically aimed work, and we ground ourselves in the ethics as we go. So there's a lot of pre-work that starts. Oh, hi, Katie. Hello. And Katie and Meg can testify. And you all know that in Coding for Food, you know that, right? Because there was an application cycle, there's a literature scan, there's all of these things that we do to set up ourselves well. And then we spend the next months until the end of May identifying what we want to say and reviewing what we need to say, and then voting on it in a consensus fashion, right? So that's the public phase. And then we go behind the scenes and submit the desired concepts into aligned terminologies, right? So this is this formal cycle that we repeat across both enhancements work and new domain work. Next slide. We have it down to a science now, I can say. I wanted to make a special version of this slide for the enhancement cycle, because when I was thinking about what we're doing in this meeting, it kind of disrupts these 4 activities that I mentioned on the activity slide, and it's specifically when it comes to one of the tasks in the program enhancement work. So yes, we have developed screening instruments and we assemble them, and yes, we develop diagnoses and we assemble them, and yes, we develop person-centered goal statements. For the work of this meeting, we're focusing a lot on the left-hand side of the screen, right? Because new domains are covering everything else. Terminology enhancements focus on enriching intervention concepts, and tools are really the focus of the Coding for Food work. Think about HCPC's development and the work of program classification that we'll talk about in a few minutes. And then again, with program documentation, some of the concepts are really not just about interventions, they're about documenting end outcomes, right? Not just that I referred someone to SNAP, but they were enrolled in SNAP. And it is, not necessarily captured within the intervention framework, so I'm just pulling it out there as a separate thing that we're focusing on in this meeting. Again, just because documenting an outcome is not, it might be an intervention, like a HCPC, like provided, like a thing provided might be the end outcome, but there's also different ways that we represent that in both clinical practice and social care. And that's the work that we're doing here in this meeting, which is a little bit different than the other one. Next slide. This is an example of the terminology we usually build. You can see my own special OG domain. Food insecurity is here. One of the paucity of existing HCPCs to represent concepts in food is partially represented here, and we'll talk more about it as we go forward in our Coding for Food kickoff. Next slide. All right, and then the final goal, this is the last of the gravity kind of grounding, like where are we going? What are we doing? What does all this plug in? Any new concepts we develop within enhancements, any HCPC concepts that we develop with Coding for Food, all get collated and grounded within value sets that are freely available for use. So if a health system or a community wants to implement gravity aligned terminology, all of the concepts we create are curated in value sets, like envelopes of data that live in the public domain for use within quality measures and regulation and population health or whatever you need. Research. Next slide. I think we're good there. Okay. So what we're going to do is we're kicking off today. And then I'm going to let we're going to get into the next slide and let my lovely friends at Full Well speak if they wish to speak. Katie's like, no. And then we'll spend the next, as I mentioned, that public identification process spends the next months working with our subject matter experts in that behind the scenes, presenting concepts to all of you, going through a formal end-to-end review, and then having a final vote. And it's Coding for Food and enhancements, because we're aiming for a vote on a couple different things in this cycle, not just Coding for Food. Next slide. Sorry, I'm talking a lot, but that's a kickoff nature. Any questions? Kickoff, welcome. Goal consensus vote at the end of May. Working on enhancements in this meeting. Okay, next slide. Coding for Food Phase 2. Woohoo! Welcome, Coding for Food Phase 2 experts to the call. This call will be fairly high level. we all will get deeper into the work when we see you in future subject matter expert meetings, and welcome anybody who cares about food, right? Remember, you subject matter experts come to these calls, but really anybody who cares about it at all can help inform the consensus work. Next slide. We have, Katie, I don't know if you were here for my first seconds. I called it the kickoff, right? Because there was the initial kickoff in the fall of 2023. Okay. And then there was a kickoff in the fall of 2024. And then there's another kickoff now. The why of why we're here in Coding for Food is really detailed very completely on the Confluence. The what, and so you please feel free to go to the Confluence and look up, background slides and purpose statements. The what that we are working on is submitting HCPC level 2 requests for 2 areas of work. Phase 1 was medically tailored meals, produce prescription, medically tailored groceries, and healthy groceries. Successfully submitted to MIRIS in December. Well, actually January 2nd, I should say. The first business day of January, and under review at this time. So congratulations to the first set of SMEs. Very grateful for your help. Our phase 2 work is cooking off, focusing on cooking and kitchen supplies. And this is a long ///, which will become a more clear concept as we go forward. The topics that are contained under the names of cooking education, teaching kitchens, and food pharmacies, right? More to come on that when we come back next week, but just noting that these are the 2 focus areas that we're working on, and there's some questions regarding them as we go forward. Everything on Coding for Food is located on the Confluence for review. It's under the food insecurity area of the Confluence, even though we know that the interventions we're talking about here are not just applicable to food insecurity, they are applicable to all kinds of needs and purposes. We had a teaching kitchen for teenagers in my community just because, right? So just noting that they're under food insecurity because it's applicable, but we do note that not for qualification for these programs, food insecurity isn't always a requirement. Next slide. Coding for work structure, you heard me call out my dear friend, Katie Ettman. So this is a repeat, it's a partner. It's really a long-standing partnership that really kicked off, like conceptualizing the necessary interventions that were reimbursable in the area of food as medicine, kicked off in 2019 when we first addressed food insecurity. We started talking about what was missing, right? What we knew we were doing and what wasn't happening, and like what couldn't be reimbursed in a consensus standard way. So it's a partnership with National Food as Medicine leaders, really spearheaded by longtime colleague and friend Katie Ettman of Fullwell, and Meg Davidson, who's a new friend. Very glad to have you. It's joined by Tim McNeil of Freedmen's Health and the Partnership to Align Social Care. So everything Gravity does, we do try to integrate and blend like expertise and knowledge and efforts. So really glad to have Tim part of this work. I first met Tim in those meetings in 2019 on necessary HCPCs for food as medicine concepts. So it's appropriate. We'll go more into it over the next slides, but there's an overarching advisory committee with leaders in food as medicine concepts nationally. And then each concept in the cycle has a work group comprised of experts in the provision of the service, right? So we have experts in the cooking and kitchen supplies section, and we have experts in the teaching kitchen, food pharmacies, snack, whatever that last one is. Great, Janice. Yay.
Yay, that was years ago, but it was really neat. It was fun.
It is really fun work. Yeah, it's really, and we have like a teaching kitchen. Oh, it was teaching kitchen. There we go. We have a teaching kitchen in my health system, that is regularly frequented by folks in the internal medicine and family medicine programs as a tool to support community integration.
We need more of them.
Yes, and you have the leaders and experts in this on the call at this time. I know he might be sick, but a little clap. The two work groups meet every other week on the path toward that 529 vote. Again, this is the same process as new domain work, weekly internal meetings, and then public meetings here. And then we're going to be consensus reviewing here, and then we submit the concepts to Maris in June. It's basically a different 6 months. It is very wholesome. Food is wholesome, literally. Next slide. And I try not to have favorites, but I was an organic farmer, and this is very precious to me. And it's like my favorite, like I have my beloved friends. Our Coding for Food Advisory Committee members, as you can see, it's American Academy of Nutrition and Dietetics, Katie Garfield from Chipley, Sarah Downer from CMI, leaders from Ceres, and, my friend Kofi Essel from Elevance, Feeding America, FIMIC, right? Food and Friends, right? We really have Brent, and David, who is on the call right now at this moment. Dr. Eisenberg. So I just want to note that the advisory committee is really one of the, driving forces behind this work and a very great aid in ensuring that we're getting it right. And then next slide. We also have our specific subject matter expert groups kicked off, and we, identified, and we're kicking off that work very shortly. Next slide. So now we're just going to go into a brief what. Again, this is just a kickoff, so pretty high level stuff. We have some new information from the MIRA submissions in December, and then when we come back in a couple weeks, we'll get more into content, right? This is like super, we haven't met yet as subject matter experts, so it's incredibly high level, and so more to come at the next call. So what is HCPCS level 1? It's what we know as CPT. Managed by AMA. So this is why we're heading specifically to HCPCS level 2, which is a standardized coding system that's used primarily to identify products, supplies, and services managed by CMS, submitted through MIRAS. One of the primary use cases that we use in this work, and you can see a lot of our literature scan comes from waivers and in lieu of services projects and state level projects and CMS covered projects. So you can Medicare, Medicaid. So this is why that level 2 concept is really the quickest reach into the entities that we are, into the programs that are happening across the national ecosystem. Next slide. This is much more granular. So Katie, you have not seen this slide yet. So this is a new slide built on Tim McNeil and my education on all of the detail, because I hadn't submitted to MIRAS for a while. MIRAS is updated. So when we think about a HCPCS submission, these are some of the things that we need to include in our recommendation as subject matter experts and community. So there are a series of critical must-have components. You have to have the definition and references. We worked on that before, but you also need to consider the population, the dose, or the unit in the moment of like labor, whether it's aligned with a clinical purpose, whether it's applicable in the absence of illness and injury, the market entry date, product, whether it's distinct from existing concepts, current payers and programs, current codes used to represent the service, whether it's prescribed, and if so, by whom, and whether FDA review is required, and if not, why not, right? So this is the list of things that go into a MIRAS submission, right? To create the approach by which CMS weighs the submission against existing concepts and necessity. Details. Fairly easy to collate, and a lot of them not applicable because food as medicine is unique, but these are all the things that we think about. The interesting things like market entry date within food as medicine, these things have been around so long that we had to put in a null value, right? Like people have been doing this work for so long, the calendar doesn't even go that far back in the MIRA submission. So just know there's some things I'm like, this does not apply. But anyway, this is what we'll be working on. And some of these are to just get taken care of, by Tim and I assisting, but some of them are the work of the, like whether it's prescribed, whether it's applicable outside of illness and injury, and certainly populations and concepts like that. Those are things that our SMEs will help guide us with. Next slide. So this is we talked about the global why, but this is another why slide. For those of you who are in the first phase, you know that when it comes to food as medicine initiatives, this is what we got, right? So all of the complexity of what we do, taking care of people with programs and provision of services, it's currently only able to be represented by 3 core codes that we see repeated ad nauseum across different state level initiatives. Tim did a really eloquent detailing of all this in the previous mirror submissions that we'll be able to copy and replicate because he's an expert in this as well. But this is what we have, and which is why we need to develop new concepts. Next slide. On the highest level, again, this is a kickoff. This is like, again, very high level. Part of the biggest thing when it comes to cooking and kitchen supplies is thinking the boundaries of the service, right? What's in and what's out, right? And so our job as subject matter experts will be determine in our definition what's included, similarly to how we did this with produce prescription, right? Like what's in, what's included, what counts, right? Because in some implementations, maybe, you know, in the kitchen section, they include cleaning supplies in the lip scan, but the cleaning supplies maybe are not, you know, it's aligned with the kitchen, with the cooking and kitchen supplies, you know, reimbursement strategy within a certain state plan, but it's actually not, you know, for the purposes of our code, it might not be in there, right? So just know that this is pretty much the base question that we have when we go into this one. And next slide. So cooking education, teaching kitchens and food pharmacies. Very simply, the unique thing about this one is we need to consider the labor of the education and the method of delivery, including whether it has a given time frame, and the supplies offered during the class, like the food you take home and use, which is sometimes used as part of the intervention. And we need to just think about whether it's represented in one concept, whether it needs to be 2, because sometimes labor and services are not able to be in the same one, and sometimes they are. Like an applicable correlation that Katie and I were using early is that when you go to a diabetes class, you often walk out with supplies, glucometers, testing kits, right? And that's included in the cost of the education. It's not separately applied. I know that got really nerdy really fast, but just know that this is some of the stuff that we have to consider when we go forward with these concepts. And our SMEs will guide us, right? And we'll figure out the bounds and we'll go from there. All right. Generally, anybody from our amazing subject matter, I mean, anyone can come on and say anything regarding the kickoff if they want to. Again, I just talked a lot, high level. Anybody want to say anything? We did sign up for nerdy. Yeah. Anything else that anyone wants to say? I know it's kind of hard to come into a national call blind, but I hope all of you who are new to Gravity know that this is a safe place that you can talk, and we welcome your voice. And then we come back. Oh, I just saw Dr. Eisenberg's face. Dr. Eisenberg, do you wish to say anything?
Just thank you very much for this orientation and a reminder that many people who work in the teaching kitchen community believe that if you've seen one teaching kitchen, you've seen one teaching kitchen. They're also
Correct.
different.
Yeah.
And they tend to be customized for the venue, the facilities, the population, the pocketbook.
Mm-hmm.
So I just enter this whole conversation with the shared view that definitions don't yet exist
Mm-hmm.
to any level of consensus. I've, written about these things for years, and I can share those as jumping off points. But unlike medically tailored meals or prescription, fresh food, produce prescription, these are harder to describe and maybe harder to put into different components of where does the education start and stop? Where do the materials start and stop? What do they take home with them?
Mm-hmm.
I'm sharing the puzzle. To me, it's an amazing process. I'm hoping you can apply it to teaching kitchens.
I love that. And I just want to hold space. I want to like support your statement in saying that uncertainty is common across this work. Like,
Yeah, you
yeah.
made me day. I'm sitting here feeling like, how is this possibly going to all work out well? So you reassure.
No, that I love that. I love that you're having that. I love that. And so I think we are accustomed to thinking about what we can standardize as we attempt to create standards, right? And you know, the uniqueness of that lens, like how far do we have to, how gentle do we have to be in the boundaries, and what is lost, if anything is lost, as we scope out, right? So that tension is, you know, I'm glad that you're giving, I mean, again, I absolutely, like, you're one of my heroes, so I'm glad I'm getting a general nod. Fantastic.
I have the flu today. I said that before, but you've made me feel much better. I'll
Oh,
be.
I'm so glad.
Thank you.
I'm so glad. That's fantastic. Wonderful. Wonderful. Okay, go team. Ah, Lena Kalinowski. Love it. All right, so this is the first initial grounding in the work at hand with coding for food. Next slide. And then this is the next steps. Work groups are going to meet. We're going to develop draft concepts and definitions and policy considerations as we go forward. I said in the next meeting, I probably should as we go forward. And just note, Dr. Eisenberg and everybody, gravity doesn't keep itself, and that reminds me, Katie, we have to circle back on the A&D thing, right? Gravity doesn't keep itself only within the bounds of standards. So if our work requires advocacy, we also use this space to create policy statements and action items and things that need to be said, like appropriate compensation for like RDN labor within the medically tailored nutrition suite of things, right? So we did that with A&D last time, and we have to bring it up through the gravity cycle, but oh wow, Sue, that's a big one. That is we have a language scan. So I think if what you're so we have a language scan that we've done to set us up. Hi Sue, I haven't seen you since the Produce Prescription Summit in DC. It's nice to see you. I think you're asking for the language scan. I think that's the closest thing, which is like our, you know, not our, I should say, Fulwell's gorgeous assessment of all the things that are happening and all the places using all the codes and all the operational definitions. And maybe not all. I'm sure Dr. Eisenberg has a lot more subtlety because it goes down from that it's like all the things that are being coded for, I should say, because operationally communities are doing activities that are not represented on the language scan. Like I'm sure my FQ supported teaching kitchen is not there. Well, I know that it's not there, right? So just noting that the language scan is a good thing. And I think we can share that, Katie. Yeah? Yes. Okay, Katie's on it, Sue. Okay. All right. Okay. So SMEs, we're going to be gathering over the weeks ahead. Community, come back and we'll keep on talking about coding for foods and sorting out the puzzle that Dr. Eisenberg so eloquently detailed. And doing it in community, which is what we do. We're about to pivot. So next slide. So this is the enhancement cycle. Any questions before we go on? Okay, so those of you who are just foodies, just know we're about to pivot into the next section of the work because this is all about enhancements. So coding for food is behind us and we're moving into program enhancements. Anyone's welcome to stay on the call. It's all about interesting stuff. But if you want to drop off, feel free to drop off. If you want to stay with us, please do. If you want us in the background while you make yourself a cup of tea, you can do that too.
Just help those of us that don't speak your language understand what the enhancements are and whether
Oh yeah, I'm about to go into that, sir. I promise.
maybe let us know whether it makes sense for us to stay or if we should be excused. Just help us with that.
I will help you with that. So I think given that it doesn't specifically apply to food, you could easily leave at this time. However, what we're going to be addressing, if we go to the next slide, there's a slide that covers it, and I'm going to give you a teaser. Next slide. So the three things we cover in the next session of the call are as follows. They're all related to us improving our suite of programs across all of our 25 domains. One is we are led by subject matter experts, developing an open classification of social care programs and gravity programs to assist with navigation and connection to services. So the specific programs that we're developing HICPIC concepts for will plug in time, right? And we're doing this because there was no open consensus free shared classification. And so you had different entities using different classifications, and it complicated sharing, care, and searching, right? And the most widely implemented national consensus taxonomy 211 HSIS, or that driven by 211 LA, is licensed. So it wasn't open. So we're all working together to create a classification of programs. We're also working on creating standards for documenting the end goal of intervention, enrollment, like enrolled in SNAP, right? So we built the refer to SNAP, the evaluation of eligibility for SNAP, and so we're building those program by program final codes that say this person is enrolled in the Section 8 Housing Choice Voucher Program. This person is enrolled in SNAP. They are enrolled in school meals, in the school meals program. They're enrolled in the school breakfast program. They're enrolled in, right? So that's what we use as clinicians, and you know this, right? To determine where to go next, right? So if they have SNAP, I can pivot, right? If like I can offer other services. And so we're developing standards to document that. Was that helpful? Great.
Thank you.
It's all really fun, nerdy stuff. All right, and great, because the great thing is explaining it to Dr. Eisenberg helped me explain it to all of you. So this is what we've been doing in our enhancement cycle, coupling coding for food with work on these enhancement areas that are across all of our domains at once. Any further questions? Yes, closing the loop, but not just in a referral way, Jonathan, because we often use the close the loop in a referral, like literally finishing the job.
No, I get it. I get it. I get it. I was just summing it up. That's what the sales guy did. So
Yeah.
like I love coming in here to those wholesome environment because like you smooth out my rough edges and I love it. So that's all.
All right. Okay. So now we're going to shift and go into updates on each of these different areas of our program enhancements work. Okay, here we go. Next slide. Program classification. Next, so this is the area of that open taxonomy. So it's a little bit different because we're not building a ton of concepts. So we're going to be building some. It's not as complex as our new domain work. So you can see we're doing this open consensus work, and then we're going to be submitting the program concepts to coding systems and then publish the classification. And that's where it's kind of unique. Next slide. Subject matter experts remain our friends in authoring and maintaining social care program classifications. 211 LA, Find Help, Epic, Unite Us, and 211 San Diego. We also are having new friends that are coming in as expert reviewers, but this is the pretty much the core. The experts in authoring and maintaining social care program classifications, it's a special set. You talk about nerdy. We joke in that group that Lena can testify. It is a nerdy set. Next slide. The goal will be this open United States core data for interoperability aligned classifications of social care program categories and social care programs. This includes things like programs. There was a question, Lisa, coming out of HSS about whether or not programs covered under SAMHSA would be in this classification. They are, and we want SAMHSA to come and help, and we'll figure out whether we go to HSS or if HSS comes to us. But it's very comprehensive. And so it's the classification of social care program categories and social care programs for the purposes of navigation and connection to services by health and social care providers and people who are self-navigating. The idea is I want help with blank, I can find the program. We're going to be coding concepts that are clearly defined and readily available in like SNOMED or LOINC. Oh yeah, so AIRS leverages, yes, 100%. There's no question that AIRS, and Elena can probably go on this, or if Nicole or Keith are on the call, the intersection between AIRS and our work is anticipated and planned for, 100%.
Yep, just agreeing with you there.
Yay, Keith! Woohoo! All right. So the structure of the classification will be published in open format for use. Method to be determined. Next slide. Oh, Mary! I'm just really like, hi. I haven't seen you in a bit. I'm just suddenly all the names are filtering in. I feel like it just slowly settles in my brain. Again, our purpose is navigation and connection to services. We're seeing a pattern of granularity across the classification, with program groupers at the highest level for the purposes of navigation, next level concepts that align with gravity-defined programs, because gravity has to define everything to the point of it is a specific program with a specific reference, with a specific eligibility and enrollment criteria, right? So we only can build things in SNOMED that have a base for truth, right? So our groupers tend to be a little bit higher level than that. This is very similar. The gravity level is shared by taxonomies such as 211 HSAS. And there's a whole other level of granularity underneath it that 211 HSAS has within its taxonomy. And so you can see it kind of starts like, so what we're developing is the highest level, and then we go down to gravity as the next level, and then there's mappings and possibilities as you go forward. All that sounds too nerdy, but there's pictures coming. Next slide. So this is an enhancement of the visual we made before. Really, it's focused not on the facet of the primary need, because we've broken that by now. What we are developing at Gravity really is, the primary need would be like food. Like I need help with food, right? The facet is generally, and housing totally breaks this, so we're just going to note that. Generally, it's sorted into dimensions of stabilization, acquiring it, and improving the quality, generally. And again, this is about the socioeconomic needs. It does not apply to the mental behavioral health concepts. So that's why the stuff on the left is a little outdated. But what is true is what we're working on, the primary work is developing the groupers, right? That helps individuals and care managers and community health workers navigate to a set of specific programs, which is where Gravity comes in next, and 211. And then 211 keeps on going in granularity. Keith, Nicole, is this, I think I see Nicole on here. Any me want to comment on that? I tried to make this visual to make it easier.
Yeah, you've got it exactly right. So we're
Yay.
talking about at a higher level in the hierarchy, how do we organize the types of programs that meet those needs? Because typically a referring provider, or like where we enter into the workflow, needs that level of detail. And then the referral manager, the person reacting to that referral, would use a program like 211 HSIS to go and identify what is the exact resource that matches this patient's full details based on the information they got from the provider, and maybe through an interview with the patient or whatever those follow-up steps might be.
Great.
And I will also just note that while we're talking about it from this kind of really applied use case, we recognize that this also gets applied and used in a whole host of other ways that is not just about navigation and finding resources, like classifying needs and identifying like asset mapping, a whole host of other applied things, but we're, for our purposes and our conversation, focusing in on kind of the applied access to services and, you know, acquisition of resources.
Thank you, Elena.
Woohoo.
Yes. Thank you. You've all got it.
Great. And I just want to note how, I kind of glossed over the subject matter expert maybe I actually don't think I did. I think I went into it, but I just want to note how radical and we do have an example coming up, Rob McClure. How wonderful and true consensus fashion and developing almost like a family. This work has been over the course of the last year. You have people who are all coming to the table with their areas of a shared purpose and a shared area of knowledge, and it's been just a joy. I had to miss the call today, unfortunately, but it's just been a total joy to work with these experts. Next slide. Thanks. So since we last met, the subject matter experts have been working on new domains. Like we never stopped. Like the classification SMEs have been meeting twice weekly for an hour since our, we went through December, we met through January, we've been meeting, we met twice this week, right? So we're always working on developing new content. There's a host of new content coming your way. But we've also been reviewing our past work, and so we're shifting a little bit how we're presenting you the content, because we did it, we did our own internal end-to-end review. So we've moved, way beyond the domains that we initially presented or presented last in December. But we also went back through and stepped back and looked at the domains we've done prior to resolve collectively any discrepancies or opportunities. This version, the internal reviewed version, is becoming the new version we present to all of you. And it will be dated, and it will have sections added for new domains as we complete. We're new domains all the time, reviewing existing domains and classifications alongside, and sections will be presented to you all in the community as we go forward. And notably, we have 2 or 3 intentional reviewers, like specific entities that we are collaborating with to do intentional review. So we're going to have this kind of convenience review through this public process here, but also very intentional review, either based on content or content topics like SAMHSA, for example, or like areas of expertise like the EPIC Collaborative, which does a 2-1-1 EPIC integration across multiple states, right? They're a perfect entity to review the applicability of the work. I'm not going to go too far into the classification tree. I'm going to share it with you, and it's going to be available on the Confluence, and you can download it. There will be a phase 1, larger classification, which is what we're going to be sending out to intentional reviewers and doing formal internal reviews among all of our different agencies. But again, this is the chunk that's available right now. So for right now, if we can, Sarah B, we can just quickly go to what I believe you were going to show. Yes. So this is the legend for you to see. Again, the classification is the level of need. I need help with food. Program super types, what about that do I need help with? And then everything in bold is the primary work, which is the classification grouper. Because the 2-1-1 LA is proprietary, it's not going to make it onto what you see here, right? The wisdom of 2-1-1 is included in this, and there's mappings that you can't see. And then everything gravity level comes under the bolded text, right? So and everything italic is something we've already identified. You can see produce prescription and healthy groceries under food prescription, which came out of our coding for food work. So everything italicized doesn't have a gravity term yet, but it's coming. So if we scroll down, you can see food all the way down and housing. In this example, if we go to housing, it's significantly different because there's so many complexities with housing. So with housing, we built, a housing navigation and coordinated entry grouper, and we divided the tree into immediate shelter, temporary programs and homelessness prevention, subsidized housing programs, and and then supportive housing for specific populations and housing stability programs. Anyway, you can see there's like a granularity that goes through in housing that is just not applicable, because connecting people to other domains, because connecting people to the right housing program is an art. That's why there's housing navigators. But again, everything in italics is coming into Gravity. Everything bold is the grouper, and that this will be available on the Confluence for review. And over the next, I would say it's going to take about a month probably to finish our internal review of phase 1. And then you can send it around to all your entities. Did I scroll by the teaching? What I have to say, Dr. Eisenberg, this made me realize I don't know if we have, I don't think we have a teaching kitchen concept yet. If we scroll up to food, my guess is it would be in community nutrition programs in some way, but maybe not. This just makes me think this is what gaps. So we have nutrition education. I don't know if it's encapsulated in that. So it makes me think, Dr. Eisenberg, that we might need to change that header, but it seems like it would be under this section, right?
At the risk of challenging,
Yeah, challenge.
throwing more complexity at this. One of the ongoing debates within HHS is looking at the nation's food challenge from two different vantage points.
Oh, I know. Yes.
One is increasing access through WIC, SNAP, other federal programs, medically tailored meals, medically tailored groceries, is helping vulnerable populations have better access to whole and better foods.
Mm-hmm.
Full stop.
Mm-hmm.
Teaching people a different relationship to food,
Mm-hmm.
educating them about which foods to eat more of, less of, and why,
Mm-hmm.
potentially how to prepare them themselves and eat them with their families. That's the education and teaching kitchen domain.
Mm-hmm.
I realize we're going to be working on describing, defining, coding for that, but that's got to be on this list somewhere, because
Yeah, absolutely.
they're part of the puzzle.
Yeah, this makes me think it's probably and Nicole, Keith, Elena, you guys are all the classification folks, but I feel like it's an opportunity to revise the heading concept for nutrition education to include that, because it's like the nutrition security, food security concept, 100% understand. And part of why we vet this is so the community can respond to it, right? So now we're going to take that back to the SMEs and consider that is noted. Look at open consensus process working.
I hope you and others agree that, just having dietitians or community education is different from a teaching kitchen education.
Absolutely. 100% agree. My FQs program that I mentioned that we have doesn't fit here. And thank you for highlighting that. All right.
Sarah, for this and other comments, what's the right written mechanism to capture that feedback?
Well, in end-to-end review, it has to be formal, like as an email, but right now, consider it captured. Because this is what the identify process is for. But consider it captured, because I'm gonna put it on the V2 tree that we're working on right now. And I'm sure Sarah Bahal, the genius that she is, has it logged as well. Sarah B, does that make sense?
Yeah, that makes sense.
Okay. And there's two Sarahs. She had to multiply herself to show screens and to be present. All right. So SMEs hold me accountable, and Dr. Eisenberg, thank you so much. All right. Okay, so that will be available on the Confluence. And again, it's on the Confluence for review and engagement. And the comment that Dr. Eisenberg made is entirely appropriate, right? That's why it's in the public view and not final. And that's why we need to kick it around. All right. So anything else, SMEs, on classification? I added all the programs from housing. I did my homework. All right. Looking forward to talking to you all on Tuesday. And again, okay, now we're pivoting again. Program enhancements has 3 different sections. Any questions on the classification? Rob, did I answer your question? I think I did. Okay, I'm hoping I did. All right,
Yeah.
next slide.
Yeah, you did. You did.
Great,
Can I ask one other question though?
all of it.
You answered it. But, and given that the 2-on-1 folks are here, I'm assuming the answer is yes, but so one of the things that we always worry about is IP. And 2-on-1 has definitely been in that space. So all of the stuff that you just displayed that the community has crafted, there's no 2-on-1 concerns with regards to that content. Right? I'm assuming the answer to that is yes.
No, not, yeah, that's why, that's, okay, I'm not gonna answer for 2-1-1. 2-1-1?
Okay.
Yeah.
And then that one diagram that you showed where the hook in for the 2-on-1 is kind of down at the most granular spot, as an example, although there's so many 2-on-1 users. So I guess I'll just leave it at that. So I just wanted to confirm that by creating this content, we're doing so in a completely unencumbered way. And
Right.
yeah.
The intent is to broaden the accessibility, usability, and the community that provides consensus and input to this level of the terminology or this level of the taxonomy. Because historically, the 2-on-1 taxonomy has been informed by its users. And obviously, the users for this taxonomy that we're building under the Gravity Project is a broader community. Nicole, anything you want to add to that?
Yeah, I would agree that it's looking at into the taxonomy at as a broader community, and also that we're contributing here just at that higher level and not the really granular level that is the intellectual property of 2-on-1 HSIS.
So is there, I mean, I'm going to say, I don't think we would have any concerns, but is there some consideration that once this work is done, 2-on-1 would just adopt this hierarchy within 2-on-1? Yeah, she's smiling.
Uh,
Rob, let's talk
I can't
offline.
help this because
Can we talk offline, Robert?
all those months.
No, I think there's okay, I'm gonna say it's gonna sound very political, Nicole, maybe you should say it. But the intent
Probably.
is the development of this classification enhances the function of navigation and connection to services irregardless of the taxonomy that's at the base. And there's ideas for how this is gonna happen. And I'm gonna leave it at that. I'm just saying we are working you can see working
Yeah, no,
hand in hand.
all of that makes me feel better.
Yeah.
I'll just say, and I'm not saying this as a definitive statement, but this actually would be best managed as an independent code system, not as a part of SNOMED, but definitely not as a part of SNOMED.
Yeah.
Okay, so we're in agreement? We're okay?
Well, no, there's probably, yeah, I hear you there. And so Rob, that'd be great. I think this is the point now where those kinds of technical conversations are really helpful, and it's been on my maybe come to a classifications meeting and help us walk through that. That sounds great.
You just invite me.
I want to, I will.
All right.
All right. Sounds like a plan. Nicole, Keith, anything else, friends?
Happy to hear the interest and volunteering from Rob McClure. So look forward to our next conversation.
Interest 1, volunteering 2. Yay. Okay. Sounds great. Go team. Okay. Program term analysis was another section. Moving on, and we have like 4 different kinds of topics. We're just noting that this work is enabled the analysis by the release of really like a foundational work and a foundational effort of the terminology team. We're calling it the Lexicon of Human Service and Social Care Programs and Professions. And it is the summary list of every single one of the programs and professions we have defined within our work at Gravity over the course of our 6 years. It's transparent because it is a really good evidence. It's really what is the evidence to how we do what I mentioned, what we're saying we do here, which is not disrupt by design, not disrupt the knowledge and definitions and practices that are happening in social care spaces and leverage definitions. So you'll see as you go down this list, it is the definition of adult care program as defined by ACL. It is the definition of single room occupancy, which is not on there yet, but it will be as defined by HUD, right? So fundamentally considering in order to support continuous use, knowledge, and an eligibility and enrollment, right? We have always, when it existed, leveraged a human service or social care definition and reference. And this, toward the goal, the HHS data strategy stated it, and the fire action plan stated it, that the goal was human services interoperability, and these terms are agnostic to gravity. They exist and can be used in multiple purposes and multiple use cases. So this is the summary list, and it's also meant to be engaged with. So the whole point of the program analysis was that users can engage with the definitions and, challenge them, and we can revise them, and we can go from there. So massive. How many, Sarah B, how many? 244 different unique programs. Is that what we had? Something like that?
It was around 200. I think I can check really quick.
Yeah. Sarah B, just your effort. It makes me grateful. It's a really beautiful piece of work in the
It's
nerdy way.
232 programs.
232. But that's available for review and again for use across HL7, across different works, again, because it's kind of the only way to see the definitions and references that are behind every SNOMED concept that we submit, because they get lost after you move from the master and they're not present in value sets. So we wanted to create this lexicon here. And again, engage, review, challenge, use, all of those things. Next slide. Okay, one last concept before we call the enhancements meeting was on program documentation, which I'm also putting a little outcomes note on. And so this is the closing the loop comment, Jonathan. Next slide. When the goal of this area of work is really to develop concepts for the end result of interventions, very simply, Dr. Eisenberg and I were talking about that earlier, right? So we at Gravity, we leverage our intervention framework and we have adjustment, assessment, evaluation of eligibility for, assistance with application for, refer to, but we didn't build an enrolled in concept, right? So when we last met, we agreed we would build both enrolled in program concepts and concepts for the program alone. And then we agreed that if you had a program alone, for some users, they could leverage statuses in a list to define that it's, a patient is enrolled in it. And that was the, determining different preferences. So examples would be the concept enrolled in supplemental nutrition assistance program, SNAP, or just the concept for the program and a status. Again, this is not the grouper level. This is a specific program level, right? It's not a general grouper. It is a thing, a specific thing with a specific reference. And so this is where Gravity and 2-in-1 plug in. We realize that some programs may need other outcomes just than enrolled. So we're going to continue to explore that with you all over the course of the next months. Like an example, enrolled in housing choice voucher program is an outcome. Actually living in a housing choice voucher residence, again, that's just suggestive, is another. Because Elaine and I talk all the time, and Nicole and Keith and I always say, you can be on a, you can be on a, housing choice voucher list for a good, 2 to 3 years.
14 in San Diego.
14 in San Diego, right? So I know, right? I know. So this is like where we just want to think thoughtfully, and we're going to go down the program list and think thoughtfully about what the final status looks like as we do this work. And not just, maybe not everyone is enrolled in, like, and is enrolled in the right concept for when someone's living in, you know, tribal housing. It's not enrolled in a tribal housing program. That just seems odd, right? So we'll figure it out together. And we're going to be reflecting on options within this cycle, with this work cycle. Next slide. All right, we did it. Enhancements call. 1, 2, 3, 4. Coding for food. Classification. Program analysis. Yay! And Dr. Heisenberg stayed with us the whole time. This nerdy group, we got you hooked. So community homework and next steps is to review materials on the Confluence. We mentioned that the Coding for Food has some backup materials. Review the classification that will be on the Confluence. Review the lexicon, you know, that all 232 gorgeous definitions and references. And come back and join us in 2 weeks, where we do keep on doing the enhancements work again. The critical new domain work as well is happening next week, and it's like, it couldn't be more appropriately, sorry, it makes me emotional. Couldn't be more appropriately timed as we work through concepts to address ethnic and racial discrimination, adverse childhood topics in toxic stress, and topics in protective factors. Again, that's next week. And enhancements in 2 weeks' time, same day, Thursday afternoons, 4 to 5:30. And thank you. Any other final comments before we adjourn? I think
Thank
we're good.
you.
Thank you.
Thank you
See
so
you.
much, Sarah.
Yes, and I'll see you in SB meeting soon.
Bye-bye.
Thank you.